All of our theory classes really did work into our practice setting. In particular, we learned a lot about the different roles nurses play and how there's such a broad list of roles. One that really stood out for me this term was the role of a communicator. And we really learned a lot about how a nurse has to communicate with the patient and the client to develop a trusting and caring nurse-patient relationship.
Also, there's another center in your community that offers music therapy for seniors.
So coming into this term, I thought that I would be learning about safe injections, and I wanted to learn about nursing skills, the things that I thought nurses do out in the community, so acute care, bandages, and stuff like that. And what I really learned over the semester was nurses do provide that kind of care, but the care that they provide that's almost more important is looking at the client in a holistic view. So understanding their mental state, their physical state, and their spiritual state, and how that's affecting their well-being.
When the students move beyond the theory into practice, they learn to be individual students, but then learn also how to work as a team. They learn to connect with people in their environment. They learn to see individuals as part of a community.
We as a community association worked in collaboration with the second year nursing students from the U of C on an initiative to get the seniors in our community out of their homes and active again. So the students went out into the community, knocked on doors, talked to the church folks. They talked to city representatives who are dealing with the seniors population in the Northwest. They started working towards getting these isolated seniors out of their homes. It's been rewarding. It's been such an active learning opportunity for the students. It's been an active learning opportunity for our community association as well. It's a great benefit overall.
The students have learned in this program theory. They learn the theory and they learn to put theory to practice within community. And we work on community health. They learn how to work with populations in the community. They learn to apply the population health promotion model. They learn to plan, assess, protect, and promote health within populations. They learn about major Canadian population health issues such as infectious diseases like tuberculosis.
Nurses in almost any setting have the opportunity to promote health in their communities or their clients. And you can use so many different action strategies to work with them, to empower them, to facilitate their needs and their goals.
The biggest thing I've learned this term is how much of a human element there is in nursing. How it's not just the medical aspect, but as a nurse you really have to care for these people and getting to know what influences their health and what's going on behind the scenes. And you really have to connect with your patients, and as you do that you learn a lot about yourself and about nursing, and it makes your practice better.